We train hospital administrators. We train people who work in health informatics. We train public health practitioners, population health scientists, health services researchers. How should that large group of students and scientists like us who are working in the field be thinking about opportunity in this moment that feels very stressful?
For the University of Washington, we have so many people who are incredibly talented, intelligent, passionate, coming in with this uncertain future. Boy, we really feel that this cohort of learners, trainers, students, and we're lifelong learners, really have a big advantage over, I think, prior generations like mine. I trained in a biophysical model of healthcare. I learned all about physiology and Krebs cycle like 15 times. Then in my infectious disease training and epidemiology, I learned about, all of the different curves, antibiotics, disease states, testing, and all of those things. What I didn't learn about were social drivers of health. What I didn't learn about was improving metrics around how do we evaluate the outcomes of what we do. It was kind of, I judged my practice with just how I thought it was. And patients, were either satisfied or not. They either come or go, but there wasn't any native feedback mechanism. I think that the learners today are way, way more sophisticated and understand the complexity of the problem much better than, I would say, my generation of trainees coming out into the world. And I think that, for the next generation, I think that the problems are more clear and the burning platform is more apparent. And I think it will drive changes in a much more rapid way. And I think that the impact of folks going into health administration or informatics or these has the real possibility of making meaningful changes and improving clinical value. But I think that one of the keys to doing that are going to be these cross collaborations. Healthcare is too complicated and much more of a team sport. And we're going to have to figure out ways to do it better together. And I think that's my great sense of optimism. I think we have groups coming out that are more aware and smarter than certainly I was. And I think we'll need to help create the organizational framework to create better collaborations. Maybe this type of venue being one of those bridges that we can build.